you.
Sure. Okay, so there are no conflicts of interest with today's presentation. And as you saw on the flyer, these are the agenda items for this presentation. Trends for substances of abuse, and that information is going to be based on what is collected by America's Poison Centers, as well as the Michigan Poison and Drug Information Center and other sources. Some clinical effects, particularly toxicity related to the effects of medication and substance misuse. And then, of course, I will always close out with a best strategy for poison prevention and reducing poor outcomes related to poisoning exposures. Okay, so the first thing that I want to touch on is just an overview of basic information. If you've never seen this before, this is probably going to be of interest to you. But when we're looking at America's poison centers collectively, there are 55 poison centers throughout the US and US territories. In those territories, we have approximately received over 2 million human poison exposure calls each year. We call these case calls. So whether we're looking at human poison exposure case call, it's the same thing. It's just different verbiage for this. So cases that originated from healthcare facilities, that's almost 500,000 on a yearly basis. And again, that has not changed. This is for 2022, but the numbers have been pretty consistent. And when we're looking at poisoning exposures by far, and this has been consistent for decades, that children under the age of 5 account for most poisonings. What is going to be of more interest pertaining to this topic today are these top 5 substances that we get exposure calls on. So the number one, and this is for all ages when we're looking at this, is for analgesics. So when you think of analgesics, these are pain medications. They could be over-the-counter pain medications. They could also be prescription pain medications, including opioids. So that's the number one reason that we get exposure calls, or the substance reason that we get calls. And then, of course, there's cleaning substances. Antidepressants are pretty high overall. So that's number 3 down the list, personal care items, and antihistamines. This is fairly new on the top 5 list. So when we're looking over the last 10 years, we haven't seen antihistamines up until 2022. And there's really good reasons for that, and we'll talk about that. Okay, when we're looking at the data for the Michigan Poison and Drug Information Center, and we're looking at calendar year 2022, there were over 56,000 calls to just our poison center. I don't have the finalized number for 2023. It takes a little bit of time to actually go through everything and make sure that those numbers are correct. But it will be, I would expect that it will be pretty much on point with 2022. And then when we're looking at the number of healthcare facility calls, that's fairly significant. So this means that somebody has already been brought into an emergency room, and now a clinician is giving us a call from that emergency room. Or in some cases, they've already been admitted and they didn't know what was wrong, and all of a sudden we're getting a call because maybe it was a drug overdose or some other type of poisoning exposure that they didn't suspect when they first admitted them. And of course, when we're looking at children under the age of 5 years, they account in Michigan for 41.5% of calls. So that's over 23,000 calls. And the numbers for the top 5 substances are pretty consistent. As I said before, analgesics, this is for all ages. We're right on point, maybe a little bit below the national average, but nonetheless, when we're looking down the list of the poisoning exposures, the only difference that you see when you look at the bottom of the list is that it's not antihistamines in the number 5 spots. spot, it's antipsychotics and sedatives. So these would be drugs that people would be using for different psychiatric reasons, as well as anxiety medications such as Xanax that people are most commonly aware of for anxiety. Okay, so before we get into some of the poison center data, perhaps some of you are familiar with what you're seeing on the screen. This is from the National Vital Statistics System with the CDC. And this is provisionary data. So if you haven't seen this before, well, good, you're getting to see it for the first time. Which means when we're looking at provisionary data, this is not finalized data. But what you can see are the different drug trends that are the CDC is actually following. And when we're looking at all of them, well, at least 4 of them, we see them trending up and some are trending down. So there are some natural types of synthetics that we do see trending down. Methadone has been pretty much even since 2015. I'm getting a little feedback there. Can everybody hear me? I just want to make sure I wasn't cutting out there. Okay. All right. And then some other psychostimulants, those are trending down. But we definitely see that opioids continue to trend up. Another thing to keep in mind when we're looking at the trends for opioids going up, one thing to keep in mind is that there's another one that you're not seeing on this list here, and that is going to be methamphetamines. So methamphetamines, when we see, I wish it was on here because it would look like a helix. Because when the opioids trend up, the methamphetamines trend down, and then vice versa. So it'd be nice if you had that image, but it's not here. But nonetheless, these are the trends that we've been seeing, and we do see opioids consistently climbing, as well as some other synthetic opioids such as fentanyl. Okay. What you're seeing right now is Michigan's data. So why don't we see anything here before 2019? It's because it wasn't available and wasn't collected before 2019. There are also some gaps, and I think that we all know where this gap comes. This has to do with COVID. So we don't have a lot of data here. We also don't have a lot of data after this time. So 2020 is really a chasm for data from Michigan. But then directly, after 2020, we do start to see the information trending. So the CDC continues to collect data from not only poison centers, but from healthcare facilities. So like I said, this information apparently was not available or not being collected from Michigan before this time. In other states who were onboarding into the system and providing data, you'll see longer histories. So it'll be good to see how this looks in a few years and see how this trend goes. So might be something you want to keep an eye on. Okay. Sorry for the blurred image, but it is what I could get. Okay, so one of the drugs that is, of course, of great concern to not only us, but people throughout the country is fentanyl. So we have seen an uptick in fentanyl cases in Michigan, as well as in other parts of the country. But what I really wanted to point out on this particular slide is that we have seen what we would consider a very significant number of pediatric exposures to fentanyl. So when we look at the 0 to 5 age, that's 433 cases in which a child was exposed to fentanyl, and that can only happen by accident. This is something that would have been in the home or in somebody's home, because most cases do originate from a home. So when we're thinking of a child being at home all day, or maybe they're with a sitter, another relative, and you see that number drop off. And there's a very clear reason why that number drops off for ages 6 to 12. It's because now children are in school, so they have less of a chance to be exposed. And of course, we do see the number climb in high school because there's more freedom and there's a greater chance of accessing certain substances. When we're looking at fentanyl, though, this is not something that is typically given to, children in general. So it shouldn't be a case where we see teenagers being exposed to fentanyl unless they had a severe illness and were being treated for pain with that. And of course, we do see the numbers climbing in the 20s and in the 30s, and then they begin to drop off. So this all has to do with just the trends and seeking drugs. Just this past year, we had 2 cases of multiple exposures is what we call them. They were on the west side of the state, and in one of the cases, there were several of the victims who did not make it. They didn't have access to Narcan, naloxone. They didn't have access to emergency response, apparently in time, to get treatment, or at least begin to get, overdose rescue treatment. In the second case, though, however, everyone survived. So that was that I think you might remember this. This happened, there was one on Thanksgiving, and then there was one in April of last year. So I think lessons were learned is what the bottom line was. People heard what happened, and even though these were people that were in their 20s and 30s, and even though they were going to seek drugs that could potentially be tainted with fentanyl, they learned what they needed to do just in case if something happened. So just to keep that in mind. Okay, some other things that are trending. We don't see a lot of this here in Michigan, to be honest, because we have legalized cannabis in Michigan. Delta 8 is a derivative that can be extracted from CBD and other sources. And it can be distributed in other states legally, sometimes not. It just really depends on what the state regulations are. But like I said, here in Michigan, we don't see a lot of it. We have gotten a few calls, but there is a significant number of smaller children who have been exposed to this throughout the country. So something to keep an eye on. Okay. So specifically when we're looking at data related to 13 to 19-year-olds, in 2022, you can see the list and for America's Poison Center. So these are the collective poison centers in Michigan. There's not a huge difference. We see a slight increase in antidepressant misuse or use or exposures in this case. Antihistamines are a bit higher here than they are on the national average. The sedative and hypnotics, again, are a little bit higher here in Michigan. And then we also have a higher rate of stimulant and street drug use. So the street drugs, let's talk a little bit about that. It seems pretty broad because it is. So this could be anything that somebody could get off the street. It could be cannabis. It could be cocaine. It could be multiple different types of drugs. So when we're thinking of cannabis, it is in this category, the stimulant and street drug. So just keep that in mind. Okay. I meant to move this earlier in the slide, but just to take a look at this is again from the the National Vital Statistics, if you wanted to know this. So we do see drug overdose related deaths trending up for 2023, but the number is not finalized yet. So just keep that in mind. Okay. So now looking at some more Michigan data. So the list of substances that are most commonly misused for ages 13 to 19. I scaled back the numbers to 10 to 19 years old. And the reason that I did is because from the Poison Center point of view, we have seen increased cases of children in elementary and middle school misusing substances and somehow having access to these substances to misuse them. It could be their own medications. It could be, for instance, an ADHD medication or other psychiatric medication, but it could also be that these substances are available in the homes that they either live in or that they visit. So, as I stated, the majority of exposures do happen in a home, whether it's their personal, their own home, or it's someone else's home. So when we're looking at analgesics, for instance, and we want to trend this, over the last 4 years, so this is 4 years worth of data, there were 5,502 analgesic exposures, but only 175 of them were opioids related to this specific age group. Okay, so that's just solid opioids. That's not anything, not any other pain medication involved in that. But when we're looking at this entire number, this could also include aspirin, this could include ibuprofen, this could include, Aleve, any of the other types of pain medications. So in 2020, you can see that it was just over 1,200. And then in 2021, we see a significant jump. And it makes sense because we were still in close down at this time. Everybody was locked down and kind of locked in 2021 still. And then we see the number drop in 2022, kind of consistent with the trends, and it continues to drop in 2023. So that's a good sign when we're looking at opioid, or not just opioid, but analgesic misuse.
Denise, in this map, the three counties that are grayed out, what is that? Do they not report, or?
It means that we did not get any cases from those counties. So that would mean, yeah. So whenever you see there's actually 4 counties because we have one up here too. So when we're looking at, all of the counties on these maps, if it's grayed out, that means that the Poison Center didn't get a call. That doesn't mean that there weren't cases, just to be clear. Because a hospital, for instance, if it was a healthcare related call, hospitals, it depends on the hospital system. They may have it in their policy that they're supposed to call the Poison Center regarding any exposure, any potential poisoning exposure, but some of them don't have that policy. So that may be the case here. Okay. Okay. And then we see antidepressants. Sorry for the break. Okay, so when we're looking at the numbers for antidepressants, there's 4,100 over the last 4 years. And when we're looking at these numbers, they significantly went up in 2021, went down a little bit in 2022, and continue to go down in 2023. And again, I think that this is pretty consistent with what we saw or what was occurring over the last 4 years. Okay. That's not supposed to say analgesic. This is supposed to be, okay. Let's see why I did that. Oh, it's going. There we are, antihistamines. Okay, so antihistamines. Hold on just a second. Calling viruses. Okay. So when we're looking at antihistamines, so antihistamines largely, when we're looking at misuse, the one that we see misused the most is going to be diphenhydramine. Okay. Diphenhydramine, if you're not familiar with that term, it's Benadryl. Benadryl or diphenhydramine or any of the drugs in that category have a propensity to cause seizures. It lowers the seizure threshold. So those cases do get pretty complicated. Other antihistamines can also cause some similar effects and other effects, but that's one that's been on our radar and that is of fairly great concern. There are some other prescription antihistamines that are used for other reasons. For instance, there's an antihistamine that's used for ear-related issues. So sometimes we will see cases where people are having adverse effects related to that. But in any case, when we see the trends, again, it's pretty consistent with everything that we're seeing with the other drugs. So in 2020, the number was lower. It started to climb in 2021, went up again in 2022, and then now it's trending down. And I think that the information has been getting out there about misuse of antihistamines. We did have quite a rash of that. It was about a year ago. And so I put out information regarding antihistamine misuse, just to make sure that, parents are locking these things up. Because if you can buy, a large Costco-sized bottle of these medications, then there's a potential that somebody could misuse it if they learn that it's a substance of misuse, even though it's an over-the-counter medication. Okay. And then we have the sedatives and antipsychotics. Okay. So again, the numbers are pretty consistent. It's good to see that these are trending down, especially since 2021, but it peaked in 2020. So one of the things that I think about with this particular category is the availability that people may have had to medications that they needed. For those of you who might know children who have attention deficit disorder, we know that it's been difficult in some cases for people to get those medications. So that's led to some other issues with antipsychotics, perhaps switching over the treatment regime. But in any case, we continue to see these numbers going down. And again, this is largely related to misuse of these medications. Okay. And then we have the stimulants. So again, this category, if I had my wish, this category would be separated out into different areas, but this is the category. So it's stimulants and street drugs. Stimulants also include amphetamines, which could be things like ADHD medication. So when we're thinking of misuse of all of these, the drugs in this category, we do see the trend going down. We did see it peak last year, but again, this really needs to be separated out. And you can certainly contact me for more specific information regarding any drug that you might think might be in this category. And I've mentioned a few of them. Okay, so let's talk a little bit about substance misuse and medication. So if you have never seen this before, a red flag warning, one of them is related to cannabis. So a while back, I was asked, what is there really any risk that people could have if they used cannabis with other medications? Can it really make them sick? Well, so I did a little digging around and I'm like, oh, the red flag warnings. So let's take a look at the red flag warnings on this. Well, there is red flag warnings. So what does that mean? That means that these two things really should not be used together at all. It's not something that you would want to. But why? why would you not want to use THC or CBD products with verapamil, which is a heart medication, and microlides, which is an antibiotic? Because there's different things there's different adverse effects that can occur. So it can increase somnolence, and it can elevate transaminases, which is your liver functions, which means it could damage the liver. There's also additive effects that can occur with concurrent use of certain medications and THC containing products. So it can increase your heart rate, it can increase your blood pressure. It can also increase the chance of developing central nervous system depression, as well as ataxia, which is difficulty with your gait or walking. And it can also decrease the effectiveness of certain medications. Now, when we look down this list, theophylline, that's a pretty old medication. It's used for respiratory issues, COPD, for instance. But then there's clozapine. And clozapine is an antipsychotic, but it's a very potent antipsychotic that we know people use for schizoaffective disorder and schizophrenia. So decreasing the effect of that could cause substantial issues for the person who needs that medication. And then we have olanzapine. So it can also it can decrease the effects, but then we also have the adverse effects. So it's just something to keep in mind. It's just something to keep in mind for people who may be using THC or CBD. A lot of people don't think about it though, if they're taking medications, but just like when we think of medications that your doctor prescribes to you, your doctor would advise you, if you're going to start a new medication or you're going to start using a substance, you want to check with your doctor first, right? You see that on all the commercials. Check with your doctor first. Well, that would be the same thing, along the same lines, particularly if you're in a state like ours where THC is legal. So what are some other drug interactions? So when we're specifically thinking about drugs of abuse or drugs that can be abused, that would be concerning. These specific ones are just a few that I pulled that are from the lists of substances that are most misused by the age ranges that I had mentioned, so 13 to 19-year-old. So bupropion, for those of you who don't know what bupropion is, that's Wellbutrin, and then of course fentanyl. So if you're someone who is taking bupropion for depression, and you happen to, seek drugs, or a person seeks drugs and it's tainted with fentanyl, they might not know this. And what can happen is it can lower the seizure threshold and increase the risk for neuropsychiatric events. So that's what we call a major interaction warning that would come up in our system with this. And when we run these interactions at the Poison Center, we might be running it, just to run it. But it might be because we're seeing these symptoms and we want to know what is happening with this patient and how they need to be treated. So hopefully, we have that information, because many times we don't. A lot of times we don't know what people have gotten into. So until we get toxicology results back, sometimes we don't know that a person has been exposed to fentanyl, and that's what's complicating the situation. And then we have oxycodone and quetiapine. Quetiapine is the generic name for Seroquel, which is an antipsychotic. So when we're looking at oxycodone and Seroquel or quetiapine, it increases the risk of respiratory and CNS depression significantly. It's a major risk for those. And so we can see people having extended symptoms and of course, worsening symptoms. And then of course we have amphetamines. Amphetamines and cocaine or things that are derived from cocaine can increase the risk of serotonin syndrome. Serotonin syndrome is something that we see fairly often at the Poison Center, especially in overdoses where people have taken too much of an amphetamine or other medication. It could be an antihistamine as well, such as what I had mentioned before with diphenhydramine. So it increases the risk of serotonin syndrome, which is the muscle rigidity, fever, seizure, and then of course it increases the risk of death in all of these cases whenever we're seeing major interactions with these types of drugs or substances. Okay, so when we're thinking of medication and substance misuse, any substance used by people taking medication can cause unknown health risks. So just keep that in mind. And some of the most common ones that we see are central nervous system depression, respiratory depression, serotonin syndrome, which I just described, and then rhabdomyolysis, which results from tissue damage. So a lot of people don't think of drugs and tissue damage, but yes, if you take too much of a drug and you overdose on it, for instance, it can cause damage to the liver, and this can cause systemic issues. And rhabdo can be very difficult to treat if it's gone on for too long. And then, of course, liver failure is something that we see with a lot of overdoses or misuse of medications, particularly if people have been on medications and then they use other substances along with those. So severe effects related to concurrent use of medications and recreational substances increases the risk of death for multiple reasons, and sometimes unknown reasons when we're thinking of somebody who has multiple drug use or things that were not able to be detected. And speaking of medications, or not medications, but substances that are not able to be detected, that's also something to keep in mind. One of the substances that is not listed here, and that you have been hearing about, is xylazine. So xylazine is something that's been popping up in from different sources throughout the US and throughout other parts of the world. But it mimics the same effects that we see with fentanyl. It's just not something that is routinely tested for on overdoses, or is easily detected. So that can actually complicate things when we don't know what somebody has been exposed to, and it could be something like this or another substance that has made its way over to the US. So, okay. So this is pretty basic. The bottom line is when we're looking at substances that you might have in your house and safeguarding substances that you might have in your house. So just like, medication, recreational substances should be kept in a locked cabinet, in a locked box, preferably in a locked box inside of a locked cabinet. So that's what we would advise. There have been cases I've had parents call, and they just don't know how to keep their kids out of things. And so this is something that I've recommended. But when we're thinking of the lockbox, you see the key in the image, but that's really not the best thing for the lockbox. It would actually be a combination lock, because anybody could get a hold of a key. But if you're the only person who knows the combination, then your child is less likely to be able to get into that. So, if there's a chance that someone would be seeking, medications or other substances in your house, do your best, try and keep things locked up and keep them in a low traffic area. So not only are we storing these things in a locked cabinet, inside of a locked box or locked bags, but we're trying to keep the storage in a low traffic area, such as your bedroom. A hallway closet's probably not the best place. The kitchen is definitely not a good place. Bathrooms are not a great place to keep it for multiple reasons, because it can actually affect your medication if you're using medication. Moisture and heat are two things that medication does respond to, that in a bad way. So low traffic areas, bedrooms, but keeping things locked up, using the locking devices, and when you're in use of medication, make sure you keep your eyes on it. Because if you do have somebody in your home, or potentially somebody in your home, or even a small child. They're quick. They can grab things very quickly. And we get a lot of calls in the morning where things like that have happened because maybe mom or dad is tired and they didn't realize that they left the cap off. And all of a sudden they turn around and the child's got that bottle out, and they're already eating pills or drinking liquid that perhaps is not for them. Okay, and then of course, not leaving purses, backpacks, bags, luggage anywhere within sight or reach of children and even pets. Okay. What is one other thing that you can do? Disposing of medication that you no longer use or that is expired. Just because it's expired does not mean that it's not effective. There's still an effective drug in there. So you do want to get rid of it as soon as possible by not flushing it down the toilet or drains, using a take back site or going to a take back event could be another way of doing this. Although I know that there's going to be more conditions on drug take back this year. That's something to keep an eye out for. But if you did want to scan the code here, it takes you to the Eagle Drug Take Back map, and that actually lets you know what type of medication you can dispose of at each site throughout the state of Michigan. What I do recommend is if you go on to this map, when you're seeking a site in your area, if you hover over the site, it's going to give you the name, it's going to give you the phone number, and it will let you know what type of medication you can actually dispose of there. So a lot of places don't take liquid medication, they only take pills. So just something to keep in mind. And also use the phone number because sometimes those things change and the map has not been updated. So just give them a call before you take in any used medications, just to be sure that you can take back those medications to that site and the type of medication that you want to take there. Okay.
I just added in the chat, the next National Take Back Day is actually coming up. It is April 20th.
Yeah. Okay, and then child resistant closures, they only work if they're engaged. They can be broken very easily. In fact, I have seen where some adults have handed pill bottles to children for them to open them for them because they couldn't open them, but the child could. So we don't like to see that, but it happens. So they only slow down the chance of somebody opening up a bottle. And when we're thinking of, just child resistant closures, that's really key to remember that they're not childproof. So it just takes a matter of time before a child or anybody else would be able to get into that container because nothing is childproof. Okay, so just some final thoughts. Obviously, if anybody is experiencing any difficulty breathing, if they're become unresponsive, if they're unable to answer questions, if they've sustained burns or other injuries or other life-threatening symptoms going on, don't call a poison center, call 911, please. Because if it's a matter that the poison center needs to be involved in, either the paramedic is going to give us a call when they get there, or the healthcare facility where the victim is being transported to is going to contact us. Okay, so if you're ever in doubt, call 911 first. But if you're sure that this is something that is really not life-threatening, or you just have questions, you know that it's something that is potentially minor, then certainly give the poison helpline a call. So if an adult has swallowed a medication that's not intended for their use, that would be fine. Even children, in some cases, in many cases, we may send a person into the ER after we hear the story. So do keep that in mind. Calling the poison center doesn't keep you out of the ER. It just lets you know what you should do, what your course of action should be. All right. And so if you need any information from the Poison Center outside of advice for poisoning emergencies, if you're looking for education resources, that's where I come in. You can contact me directly, or you can go through web address that you see at the bottom, which is on our educators and caregivers page. So you can visit our webpage at mipoisonhelp.org. And go to the educators and caregivers page, and any information that goes through there is directly sent to me. Just to keep in mind, next week is National Poison Prevention Week. So I do have some programming that's going to be available, as well as more programming from America's Poison Centers. Okay, a little bit about our team, just so you know who works there. We have at the Poison Helpline, we have our specialists in poison information, who are all physicians, nurses, and pharmacists by trade. And we also have our clinical toxicology consultants. So both our specialists in poison information and clinical toxicology consultants are available 24 hours a day, 7 days a week. I am just one person, so Poison Center Educator is not available 24/7, 365, but I am by email, and I always follow up with people. So thank you. And if you have any questions, please let me know.
Thanks so much, Denise. That was a lot of really great information. I have a couple questions. I wanted to clarify, so it's not law that health centers or hospitals are required to report to you?
No, they are
Okay.
not. No, they're not legally obligated to contact their poison center.
Okay. And then, so that kind of brings me to my next question is there's probably a lot of like unreported incidences happening throughout the state, but throughout the country also.
I would say, yeah, definitely throughout the country and throughout our state. Like I said, there have been some hospitals that have made it policy that they contact the poison center, our poison center. Our poison center is actually part of the state's constitution. So we're covered in that. And whenever there's a situation, for instance, wherever there's a situation in which the hospital may not realize that they should be calling us, or that we would be considered part of the care team, then they can contact their safety officer, because we have already done all the work with all of the hospital systems. Our medical directors have already filed letters with them. So everything that we do is HIPAA compliant.
Okay. And then I had one other question. So if folks wanted to get some more insight in their specific area, are you able to pull data from by like county or city or township? How far down can you go?
We can do it by zip code.
Okay, awesome.
Mhm.
That's
Mhm.
cool. That's great. So I will open it up and ask if anyone else has any questions or comments. They can go ahead and come off mute or put it in the chat and I will read it out loud. I did see in the chat, Jane said, is there a gift card? And I wasn't sure what you meant about that. If you want to explain in a little bit more detail, hopefully I can answer that question for you.
Really quick, I was wondering, has anyone ever considered with a drug take back to maybe consider the branding to like a medication type situation? I know I didn't always correlate drug take back with the opportunity to return unused medicines. And so I have just wondered about that. This might not be the right place to talk about that. I was just curious though.
I'm sorry, Effie, what were you asking me that question?
Yes.
Okay, can you, I guess I wasn't clear on what the question was.
So for when we talk about like drug takebacks and we share drug takebacks.
Sure.
When you had just talked about, like the
Mhm.
medications and things.
Mhm.
I know like there are probably some people who don't correlate drug take back to here, this is my unused, expired medication and I can return that safely. And so have we considered what the marketing for that is, or should we say something like, medication take back, or, something that is a
Mhm.
little bit more clear. I know, and this
Mhm.
sounds so dumb, this is almost embarrassing, but before I got in this profession, I had thought drug take back was, oh, you're trying to get like drugs off of the street and not return the rest of your unused, I don't know, what's a drug? I don't know.
Yeah. Yeah. Um, yeah, medication take back. I think that I don't know that well, it's a DEA that hosts it, the national take back
Right,
when we're looking at
right,
that.
100%.
And so yeah, they do say drug take back, and I'm just like with, any kind of
I think we lost you, Denise.
Denise,
can you hear me?
I
Now
can
we
hear you.
Okay. So